I will talk a little bit about the project we are running, which is here in the region in Southeastern Europe, about the smart health. So maybe I will first start with short introduction of myself. So I'm really director for Gate Institute, but before that I'm professor also at Sofia University, and my background is software engineering, more technical. I will share some information about the Gate Institute because we are a relatively young organization. We were established 2019, we are financed by EU, and the aim is to build this Gate Center of Excellence in big data and artificial intelligence, which will be the change maker in the game changer in the region. So our focus is on big data and AI research, innovation, and education as part of Sofia University. And this we are doing in collaboration with different stakeholders, government, industry, entrepreneurship. And in our way to build this Center of Excellence, we are supported by Chalmers University of Technology and Chalmers Industry Technique. So that's why we are so close, and we are already collaborating. And as to have an idea about the scale of our institutions, currently we are almost 50 people, and for these 5 years we already are involved in 20 funded projects, most of them European projects, and Data Space Support Center is one of the projects we are involved in. We are associated partner. European Mobility Data Space is another project which you saw where also Ilieva and Natalia are involved, and many others related to big data. We already have 2 patents and a lot of project partners within this project. Usually we are between 12, 15 different partners. We initiated from the last academic year a master program on big data technologies. And so we had a lot of internship students who are supporting us in our research activities. And we are members of strategic initiatives at European level, like Big Data Value Association, International Data Space Association, where we are hub for Bulgaria, and very soon maybe we will become an official training provider on data space fundamentals, which is very much needed for the innovation system in Europe. And also from 2022, we are recognized as a NATO testing center to test the different technologies with potential of dual use for different startups all over the world. And our research in big data and AI focused on 4 application domains: future cities, smart industry, intelligent government, and digital health. And today I will present our activities in part of our activities in digital health, and especially this project named VELES, which we are coordinating and which we initiated. That's the concept. It comes from GATE, and we started the project last year, and it's with duration of 4 years, and it is funded again by EU. So the consortium is from 15 partners from 7 countries. So we're having experienced partners from Sweden, which is CIT, from Germany, which is International Data Space Association, and Spain with Insomnia, which is again organizations which is dealing with commercialization of research results and innovation. And our project is focused on countries in Southeastern Europe, Romania, Bulgaria, Greece, and Cyprus. So we, in the consortium, we attracted organizations with from different different stakeholders representing academia, industry, citizens, and government. And it is important the involvement of the public authorities because of the recommendations and decision that should be taken at the level of each country in order to change the rules and the procedures to be able to exchange data and to for secondary use of data and to stimulate the innovations. So the members of the consortium are also, in addition to the policymakers, who are from different universities and public bodies, academia like GATE and Sciences is another center of excellence in Cyprus, who is dealing with emerging technologies and again funded by EU. A lot of industry and practitioners, partners, both from technology providers, health solutions, and also different, like Joyce, this innovation park in Greece, who brings a lot of different stakeholders in the country. And we would like to see the voice from citizens, who are different clusters from countries are involved, like Hellenic Digital Health Cluster, like Health Life Science Cluster. From the first is from Greece, the second from Bulgaria, and also the last from Romania. So we're having different viewpoints from all partners. Okay, so the challenges which motivated us to initiate this project, which are in our 4 countries, the first one is because we are lagging behind in terms of digitalization, especially in the healthcare sector. And the current regulations in our countries provide a framework to set up these centralized healthcare databases, which we are just creating different registers which are in different places, and there is no guidance and on the interoperability standards, which is very much needed. And also this innovation potential, which is in the healthcare domain in our countries, is growing. So there are companies who appear, but we need still specific policies and instruments which to support those companies. And also we need guidelines in their innovation excellence, especially in healthcare domain, which is very much of interest in our countries. So we decided to establish this Wellness Hub for those countries, widening countries, which we are having. We are behind the others, but at the same time, we have a lot of opportunities, having in mind the activities at European level and stimulating the European health data space, which aimed at 2025, and also the regional smart specialization strategies in each of our countries, where the health domain is and digital health is put on the center. So a lot of attention there. And our vision is to create these sustainable place-based innovation ecosystems in those countries, and which will be enabled by regional smart health data space, which we would like to pave the way to create this. And this we'll do in steps for these 4 years. So the first is we would like to establish this novel transformational framework in those countries, the new R&D, research and innovation and investment strategy, action plan for the research development, and adoption of these innovative and secure digital solutions, which will be the base for sustainable health services. So this vision is transformed to the objectives and goals of our project. So we would like to we have paved the way to this regional smart health data space, which then will be easy to integrate at European level with other data spaces in other countries. And we would like to demonstrate this regional smart health innovation potential. To transfer this, we'll do by transferring the knowledge and good practices from both from our countries in the region and from our advanced partners who are member of the consortium. And that's why we would like to ensure this long-term strategic joint research and innovation development in line with these regional and national strategies which already exist. And here is the illustration of the concept we are following. So we're at the first phase where we are developing this framework for the transition in the health sector for digital health, where we analyze the current situation and especially this legal and policy background, which is very much needed to be compliant with the EU regulations. During the day, you heard about different, and also from Natalie, about different regulations at European level which exist, and we need to be compliant with them. And also these recommendations from this framework about the concrete steps what have to be done and changed in the countries on different aspects. So we are covering not only legal, but business, technological, organizational, and ecosystems. All those aspects are covered from these recommendations in different countries. And the second stage, we will step on the existing assets at the International Data Space Association, where we are member of and also their partner in the project, of the existing components, the IDSA broker, reference architecture, application store, and connector, which we already discussed about the connector, which is the reference architecture of this component. It's provided by International Data Space Association. And we in Bulgaria already created this minimum viable product. So we are having our own connector implemented, which refers to this recommended architecture. And based on these already existing assets, so the new assets will be developed in order to establish this regional smart health data space. So with these integration services and the infrastructure, the architecture between different countries. And this will be validated by 4 different use cases. So in Greece, they will be focused on cancer data, in Romania in cerebral tumors, and we in Bulgaria on Alzheimer's disease, and Cyprus in dementia. So through different such research projects, we'll share data and hopefully between different countries. And at the third phase of the project, so there will be some outcome from these pilot projects and some concrete steps on the policy changes about joint strategy for research and innovation in our 4 countries, investment and action plan for the future, which includes both public funding and private funding. And on the left side, there are some benefits for different stakeholders, which are here, but I think I am out of time. So the expected outcomes are already this joint strategy, long-term strategic agenda, which is for those 4 countries, synchronized and common investment plans for infrastructure to support further research and innovation in the field. So we're happy to collaborate. Not yet the second stage is to compete, but still we are open to collaborate and implement this for the future innovation in health data. Thank you.
Thank you, Sylvia.